What are common myths about childhood concussion symptoms? Imagine a child falls during play and hits their head. Many people think certain things about what happens next, but some ideas are actually myths. Let's clear up some common misconceptions about childhood concussions. First, many believe a child must lose consciousness to have a concussion. That is not true. Less than 1 in 5 children with a concussion pass out. Most will just have symptoms like headaches, dizziness, confusion, or sensitivity to light and noise. So, a child can have a concussion without passing out at all. Another myth is that you need a brain scan like a CT scan or MRI to diagnose a concussion. Actually, these scans usually look for structural damage, which is not the main issue in concussions. Doctors diagnose concussions based on symptoms and a physical exam. Imaging tests are not always necessary unless other serious injuries are suspected. Some think helmets prevent all concussions. Helmets are great for preventing skull fractures and severe injuries, but they do not fully stop concussions. Concussions happen when the brain moves inside the skull, which helmets cannot completely prevent. Many believe children recover from concussions faster than adults. However, kids' brains are still developing, so they often need more time and careful care to recover fully. It is not always a quick fix. Also, some think symptoms appear immediately after the injury. In reality, symptoms can be delayed. They might take hours or even up to 2 days to show up. That is why monitoring a child after a head bump is so important. Another myth is that you should wake a child every few hours to prevent slipping into a coma. Once a healthcare professional rules out serious brain injury, it is safe for a child to sleep normally. Waking them repeatedly is unnecessary and can interfere with recovery. Some believe a concussion only happens if there is a direct hit to the head. Actually, any sudden jolt or movement that causes the brain to shift inside the skull can cause a concussion. For example, a fall landing on the back or a blow to the body can do it, even without hitting the head directly. Lastly, many think that if a child plays through the pain, they will heal faster. That is not true. Continuing to play or do physical activities can make symptoms worse and delay healing. Rest and proper care are essential. Knowing these facts helps us recognize and manage concussions better, keeping children safe and on the road to recovery. If you ever suspect a concussion, always consult a healthcare professional for personalized advice and treatment.